How to understand your epilepsy EEG report. Understanding your epilepsy electroencephalogram report can feel overwhelming, but breaking it down into key components can make it easier. An electroencephalogram, or EEG, records the electrical activity of your brain. The report provides valuable insights into your brain's function and helps in diagnosing epilepsy and seizures. First, let's look at the background activity section. This part describes the normal brain wave patterns observed during the test. It shows your brain's overall state, whether you were awake, drowsy, or asleep. Normal background activity can vary based on age and alertness. If there are signs of abnormal slowing or asymmetry, it could indicate brain dysfunction or areas that might be prone to seizures. Next, we have abnormal findings, often referred to as epileptiform discharges. This section highlights any unusual waveforms that suggest a higher risk of seizures. These might include spikes, sharp waves, or spike and wave patterns. Neurologists pay close attention to these markers as they are crucial for supporting a diagnosis of epilepsy. The report will also specify where these discharges occur on the scalp, helping to localize the brain region involved. Sometimes the EEG includes activation procedures. These are special maneuvers, like hyperventilation or photic stimulation, designed to provoke abnormalities. The report will indicate if these procedures triggered any epileptiform activity, which can provide additional diagnostic information. Another important aspect is symmetry and localization. The EEG report assesses whether brain wave activity is symmetrical across both hemispheres. If there are focal abnormalities or asymmetries, it may suggest a specific area of the brain responsible for seizures. The clinical correlation and impression section summarizes the EEG findings in relation to your clinical history and symptoms. This part uses simpler language to explain whether the EEG shows evidence of epilepsy or seizure activity. Phrases like "no epileptiform abnormalities" or "no electrographic seizures detected" can be reassuring. In contrast, terms like epileptiform discharges present indicate a higher risk of seizures. Finally, the report may contain additional notes, including comments on the heart rhythm recorded simultaneously. This is important because some seizure disorders can affect cardiac function. For practical tips, remember that EEG reports are often technical and primarily written for neurologists. If you receive a copy, don't hesitate to ask your doctor to explain the key findings in plain language. A normal EEG does not completely rule out epilepsy, as seizures may not occur during the recording. Sometimes, sleep-deprived or longer-term EEG monitoring is recommended for a clearer picture. The presence of epileptiform discharges can support a diagnosis of epilepsy, but it must be interpreted alongside your clinical history. Avoid trying to interpret the EEG report on your own. Always discuss your results with your neurologist, who can integrate the findings with your symptoms and guide your treatment options. In summary, understanding your epilepsy EEG report involves recognizing it as a technical description of your brain's electrical activity. It highlights any abnormal patterns linked to seizures and interprets these findings in the context of your overall clinical picture. This comprehensive understanding helps your healthcare team make informed decisions about your diagnosis and treatment.